What is psoriasis? In this video, we discuss the 7 types of psoriasis with some information and statistics. If you suffer from psoriasis, you will know this much: it can itch, but it doesn't always, it looks terrible, it is often painful, some people report severe pain, but about half of all patients don't really mention much pain during an attack. It results in crusty or oozing pustules, and can come back again and again without any real notice. Okay, so you know what psoriasis looks and feels like, but do you know what it really is? The medical definition of psoriasis is something like this. It's a chronic inflammatory skin disease that is not contagious and is characterized by silvery white scales, crusty sores and/or bleeding lesions. During a psoriasis attack, you can expect to find a type of scaly rash on the elbows, knees, scalp and back. However, it can appear all over the body, even the face. Those with the most severe cases of the disease report coverage of anywhere from 50 to 80% of their entire body. Psoriasis can be quite mild or it can be extremely severe. Anywhere from 15 to 30% of all patients report severe outbreaks that impact their daily lives or even become disabling. Psoriatic arthritis is one of the main side effects of the disease, and when present, can limit a patient's ability to work, or even walk, making all movement excruciatingly painful. In addition to how it looks, and the arthritis it can cause, psoriasis can feel itchy or even increase into a major burning sensation. Depending on the level of discomfort, patients may be unable to concentrate or focus on the task at hand. Relationships and leisure activities may also be impacted, as the patient's condition deteriorates. The types of psoriasis. There are several different types of psoriasis that patients must deal with. Each degree offers its own level of pain, discomfort, emotional trauma and health-related side effects. To better understand what you are dealing with, look here to find out which of the 7 main types of psoriasis you suffer from. Remember, it is possible to suffer from more than one type of psoriasis at the same time. Number 1. Plaque psoriasis. Common vulgaris. Considered the most common form of psoriasis, common vulgaris, or plaque psoriasis is easy to spot. It features round or ovalish pustules that appear in a symmetrical pattern, usually around the elbows, but it can also affect the scalp and genitals. Raised areas of the skin appear to be a silvery white or powdery scale, which is usually at least 1 centimeter in diameter but, in many other cases, much larger. Plaque psoriasis features a distinct border between affected skin and unaffected skin. Nearly 90% of cases involving common vulgaris last for days, weeks or even months. 2. Guttered psoriasis. Guttered psoriasis is usually suspected when small red, scaly bumps appear to arise on the skin's surface, within either a few days or weeks after a strep infection of the throat is diagnosed. These tiny red bumps, usually only 2 to 3 millimeters in diameter, may appear in one isolated area, but usually cover larger areas on the trunk, arms, and legs. Children are most susceptible to this type of psoriasis after a throat infection, usually recover quickly with no recurrence. On the other hand, adults usually aren't so lucky, often reporting repeat flares after an initial attack. 3. Flexural inverse psoriasis. Found in the folds of the skin, like the breasts, armpits, groin and buttocks, flexural inverse psoriasis is often misdiagnosed as a candida yeast infection. The reasons are simple. This type of psoriasis does not show the typical scaly, silvery pustules but instead a smooth, shiny salmon-colored rash. Often extremely uncomfortable, it is also difficult to treat due to the fact that it is hard to keep these parts of the body dry. 4. Erythrodermic psoriasis. One of the most severe forms of psoriasis, erythrodermic psoriasis often takes over the skin, covering as much as 80 to 90% of the body's skin surface. It can become so red and inflamed that the victim looks much like a boiled lobster. Scales and peeling are so severe that the skin actually looks and feels raw. There are two types of erythrodermic psoriasis. A chronic plaque-like version that appears after plaque psoriasis begins to worsen and spread over the entire body, and unstable psoriasis that is triggered by such things as stress, trauma, illness, or even corticosteroid use. One of the things that makes this form of psoriasis so horrible is that it also brings on a variety of other health attacks, including high fevers and chills. Patients are also much more prone to skin infections during a flare-up and may even find it hard to maintain normal fluid levels and body temperature as a result of the disease. Those with heart disease may also be at a higher risk of heart-related complications. Immediate medical care is necessary during flares of this type of psoriasis attack. 5. Pustular psoriasis. Often triggered by infection, stress or some medications, pustular psoriasis comes in two main forms. Generalized, which can cover most of the body, and localized palmoplantar pustulosis, which affects only the hands and feet. People suffering with generalized pustular psoriasis can become seriously ill, as non-infectious lesions begin to appear on the body. These blister-like pustules are small and raised, yet, can cause a lot of pain and anguish amongst the sufferers. 6. Exfoliative psoriasis. The most severe form of psoriasis, it affects the entire body with untreatable scaling and inflammation, ultimately leading to the patient's death in just 2 to 3 years from the start of the outbreak. 7. Psoriatic arthritis. When the psoriasis has become so severe that it begins to affect the joints, psoriatic arthritis is diagnosed. In the past, this disease has been confused with rheumatoid arthritis, but blood tests will confirm a lack of the rheumatoid factor in the patient, making it apparent that the psoriasis is causing the demineralization of the affected bones and joints. So, there you have it, 7 types of psoriasis. Do you have anything to add to this video? Any remedies or frustrations? Comment below and hopefully we can all help each other on our journey to recovery.